The number of confirmed coronavirus infections in the country stands at 50. 8 more cases, including one from Kitui, have been confirmed, with 7 of the 8 new cases being close contacts of people who had tested positive. The Ministry of Health is now warning of a new trend, community transmission of the disease. KTN senior reporter Rita Tinina leads our broadcast tonight, reporting that the country could have up to 10,000 cases of the virus in the next 1 month if the government's projection is anything to go by.
We have received confirmation.
Words that are now characteristic of Health CS Mutahi Kagwe's daily press briefing on the coronavirus, a day after 4 more people tested positive for the disease.
We have received confirmation of 6 patients who have tested positive for the coronavirus disease, and an additional 1 patient from the Aga Khan Hospital.
1 person out of the 2,050 people who are under mandatory quarantine also tested positive following analysis of 84 samples.
The 8 cases are now spread out in various counties in the country. Kitui now has 1 case. The total number of confirmed cases now stands at 50 in the country.
Initially, Covid-19 cases in the country were imported. Now the trend is changing. 7 of the 8 new cases are close contacts of confirmed cases.
It is evident that the virus is now being spread through community transmission. This now calls for a lot more personal responsibility among Kenyans in this fight against the disease.
And Kenya could be in for tough times if the government's projection is anything to go by.
Our modeling puts us at having about 1,000 cases by the first week of April, and we postulate that we'll have 5,000 cases by mid-April and potentially 10,000 cases by 30th of April. So those are the figures that we are working with in terms of how we preposition our personal protective equipment, how we preposition our test kits, how we preposition our human resource, and how we preposition our isolation and quarantine facilities.
Mutahi Kagwe says Kenya has over 20,000 coronavirus test kits, all of which have been validated. But going by the number of tests done to date, just 1,005, the pace, it appears, is quite slow.
We have agreed in consultation with our technical team that we are only going to test those who are in quarantine after the 8th day. But remember also, the laboratory capacity that we have, we can only do 300 samples in 24 hours.
In a new measure, the government has now directed border operators to carry only 1 passenger.
The border rider and the passenger must wear masks for protection. We shall be spreading out masks in the counties for this purpose.
With just over 4 dozen confirmed cases and 1 death in 19 days, the government is banking on the social distancing and basic hygiene campaign to contain the spread of the disease. And if global trends are anything to go by, for a country with a fragile healthcare system, the war against the coronavirus will be one of the biggest health sector challenges yet for Kenya. Rita Tinina, KTN News.